Good evening, Bistro fans. Dr. Jill and Dr. Christina here. Welcome. I'm so glad you can join me.
Happy to be here.
Yeah, another Monday night of chiropractic chat. It's always exciting. There's always new stuff and new cases and new things to talk about. So if you guys have been catching us over the last several Mondays, we have been here every Monday at about 7:30 to talk about chiropractic care and how it is beneficial for your cats and dogs and how it can help. Although Dr. Cole and Dr. Grant are not limited to just cats and dogs, they also have chiropractic support for horses and steers and what else have you done? Raccoons and squirrels and
bunnies, guinea pigs.
Bunnies, yes, bunnies. Anything that basically has a spine, you guys have worked on. So that's really awesome. So I know the last few Mondays we've really talked about like hips, knees, joints, like all of those good things that need support and why chiropractic can be really helpful. So tonight we're going to continue up the spine a little bit more and talk about pinched nerves. But before we do that, I actually brought home to show everybody my jar of collagen. We have talked about this, have been talking about this for pretty much the last 4 or 5 Mondays about how collagen can be really supportive to bones and joints and all that fun stuff. So I kind of set out on my own little journey and I just brought home my second jar of collagen. I think I'm going into week 4 of having basically a scoop of collagen every day. So I actually just mix it into my immunity drink that I make every day. So I'm the kind of person that I don't like if it turns gelatinous or like into jelly, I'd be out. I'd be done. So this is Nature's Sunshine. This is actually grass-fed, pasture-raised beef. It is also non-GMO, keto-friendly, paleo-friendly, gluten-free, dairy-free. It's hair, skin, nails, bones, joints, gut, trace minerals, you name it. There's a whole bunch of stuff in here. So, and this we sell at the store. It's totally safe for your cats and dogs. You could, if you already do goat's milk or bone broth or some sort of canned food, super easy to mix in there. It's a really fine powder. So if that is helpful, I know kitties are a little harder because they always seem to sneak out any little difference to their food. They're all about it. But so I would say the scoop in here is probably about a tablespoon worth, which I've been taking daily. Cats probably need a little less. Dogs probably need a little, depending on the size of your dog, more or less. Trying to find the scoop here. I'll show you guys. So here's a good scoop of it, and you can see it's actually really fine powder. I actually just put it in my water in the morning, shake it up, and away I go. So I thought that since I had it already in all of my belongings to come home tonight, we've had a lot of chat about that. So if people are interested or supporting it, I know that's one of your favorite supplements, Dr. Cole. So it's mainly beef. Is most collagen beef? I don't think I've ever really seen other animals.
We started taking marine collagen because it was actually back when Grant and I were pretty much just vegetarian. So we were pescatarian. So we were doing the vital proteins makes a marine one, but I don't think they make it. Or if they do, it's not as easily defined. But yes, most of them, it seems to be beef, more or less. I think I found a couple ones that are pork. What I'm on right now is like a beef one as well. So I think you can find, like, if you search for ones, if you need something that's like veggie, but otherwise, the beef is good. I think of all the tastes, that's the least taste that I've ever gotten. Like, I know with the marine, even though it was tasteless, I could like, but they're all good. Can't go wrong.
Yeah, no, I would agree with that too. It doesn't, like, if I mix it in my water, I can't say that it tastes like beef broth per se. Like, you don't get it taste at all. So pretty cool. And I will tell you personally, I don't feel as achy. Getting out of bed in the morning seems a little easier. My knees, I'm at the store, we're up and down off the ladders and carrying 40, 50 pound bags of food and in and out of the freezer, loading and unloading, getting things off semis, you name it. So I would say that just in 3 weeks, it's been about 3 weeks for me that I would say I feel like and I've never been the most agile, flexible person on this planet, but I feel like it's helped. So
yeah, for sure.
Probably help your puppies too.
Yeah, absolutely.
All right. So we've talked about a lot of the back end, hips, sacrum, knees. What else do we hit on the rear end there? DM, IVDD. Got a lot of stuff that we've covered. So tonight we're going to roll into pinched nerves. And boy, oh boy, do those doggies, when they come in, they look so painful.
Yeah. It's really sad. So pinched nerves are super common in dogs. And I would say probably I've seen a handful of them in cats, but again, cats are just way more agile and I think they treat their bodies a bit better than your dog does. So we don't see quite as much of that. It does happen, but not super often. And I would say the majority of the cats that are having issues tend to be more of the outdoor variety, and they might be more of like the hunting and a little bit more active sort of situation. But with dogs, it really affects all ages. I mean, we've seen probably as young as like a 6-month puppy with a pinched nerve, and then obviously all the way to your super senior dogs too. I would say probably it's one of those things where it looks extremely awful and it sounds awful. So last week we kind of talked about disc issues, and one of the symptoms of that is, paralysis in the back end. And I kind of talked about how it's not painful because your body has basically shut off communication. Well, with pinched nerves, it's almost like you're in this weird in between, depending on what's causing it. And it is pretty painful. I don't think I've ever come across a dog that has a pinched nerve that's not in pretty moderate to severe pain. We've seen them to the point where they literally cannot move their head because any movement one way or the other triggers that pinching of the nerve, depending on where it's located in their neck. And same thing in their back end. You oftentimes see like hunching in their back and limping and that sort of thing. So while dogs and cats don't necessarily get like what we would think of sciatica or, different specific names for the different pinched nerves, like they're very, and it can be caused by any number of reasons. So, you can have multiple spots where a nerve can be pinched. So for instance, if we have a pet coming in that's limping on their front right leg, it's most likely not something that's coming and they've already been checked out and, nothing's going on in their arm that's notable. Well, all the nerves that exit out of their neck go down to their front legs. So if you've got a pinched nerve in your neck, most likely you're going to get some limping or some dragging or some knuckling in one of those front legs, depending on whether if it's on one side or the other. Sometimes you get it on both sides if it's more of a central pinched nerve, like if you've got a disc bulge that's putting pressure on both nerve roots. So it can be pinched by muscle. It can be pinched by, ligaments and tendons, depending on if it's further down in a limb. But I would say the majority of the pinched nerves we see come from actual malposition and decreased range of motion and pressure from the disc itself. So not all of them are coming from a disc bulge, but a lot of them kind of stem from the very center of your spine. And when they're super young, it's probably that it's not a bad disc bulge at that point. It's just that the mobility has basically gotten locked, for lack of a better term. And then every time, if your joints aren't moving and every time you try to move one way or the other, it's already stuck. So you're kind of adding insult to injury. But the nice thing with these situations is they do tend to recover really nicely. It's just those first, I would say maybe week or two are really rough because they're so inflamed, and everything your dog does on a normal basis is going to aggravate it. So I think people, if you watch your dog, you'll probably see them shake it off, do a whole body shake or a head shake or whatever multiple times throughout the day. I mean, dozens, just because it's a stress release. It's I just got done playing, and they'll shake, that sort of thing. Well, if you've got a pinched nerve in your neck, every time your dog tries to do that, it's going to aggravate it. And then you'll get these screams. And if anyone's had a dog with a pinched nerve, they can probably attest to the fact that it sounds a lot of times like a baby seal just crying out in this excruciating pain. And a lot of times it doesn't end. There's literally nothing you can do to kind of let them know that it's going to be okay. And they also don't realize that it's the shake that did it, right? So it's just their body's inherent way of doing something is to shake it off. Well, how do you tell them to stop doing that? So you can't. They just either deal with it and have it happen every time, or we obviously can help with it. So that's one way that it gets super aggravated. If you have pets that are really jumpy up and off the furniture, that aggravates it a lot too. So in that beginning stage of a pinched nerve, it's very delicate. You have to be very cognizant and almost make decisions for your dog, especially when it comes to things that you can control, like jumping up and down and their walks and, collar choice, things like that can all be controlled by us, or getting in and out of the car. Whereas the shake, we can't do anything about that. We can only help like palliatively or do whatever we can to kind of soothe them while they're going through an episode. But there's a lot of things that we can do as owners to at least help them feel a little bit more comfortable while they're healing. And the other thing with a pinched nerve is like, that's not something that just goes away. So a lot of times we've talked about arthritis and how these dogs are getting younger and younger and younger when they start showing signs of it. A lot of it stems from things like this. When they're younger and they play really hard, they tumble, they wrestle, and they end up getting these little mild, like locked up vertebrae that don't move properly. That a lot of times leads to arthritis. Well, if those vertebrae aren't moving properly, then a couple years down the road, they might just move just the right way to then lock themselves out and pinch a nerve. So a lot of times folks will be like, well, I don't understand what they did. Again, it's not what they did. It's the 100 of times they did something in a compensatory way that did it. It's not, very rarely is it a trauma. It might be the 20 times your dog fell off the bed, like that kind of trauma, but very rarely is it like the one time they fell off the bed and now they've been injured. More often than not, it's a buildup. It takes a while for a joint to get so locked that every time it moves, it pinches on a nerve root. So there's a lot that goes into it. And pinched nerves are definitely something that can be very preventable. Like we do work on a lot of dogs. That way they hopefully don't have these situations. That's one of those things when people ask why their puppy might need to be adjusted. Again, watch them play. If they come up lame, limping, anything like that, like those could be really early signs of just things getting locked up in their body. So that's something that chiropractic can help to make sure that everything's moving nicely. So you're not getting these areas that will then be prone to having issues later in life. So prevention is always preferred over, working on them after they're in baby seal mode. But either way, it's definitely something that can be managed both conventionally and alternatively. So I would say that when it comes to pinched nerves too, it is one of those conditions that I would say the ones that recovered the best are doing like a mix of both conventional and alternative treatment, because sometimes they're so severe. There's only so much that we can do practically when their muscles are just like, fired at 100% and you can barely move their neck. So it is something where I would say probably the most beneficial, especially for neck pinch nerves, they do tend to put them on muscle relaxers, which makes our job a little bit easier, because if I can at least work on your pet, then hopefully we can get them to the point where they don't need those muscle relaxers. So sometimes Grant and I will have folks come in that have a dog in excruciating pain. And the very first thing folks will say is, I didn't give them their pain or their muscle relaxers today because I wanted you to see how they are. And while I appreciate it, I'd rather you take a video and show me that way, as opposed to bringing in your poor baby that can't move their neck at all. If there's something that gives them some comfort, I have no issue with you using that short term so we can at least work on them and then hopefully get you to the point where it's not a problem. But yeah, super common. I think your next slide is about who gets them. So we can talk about that, or maybe the symptoms.
Breeds and ages. Yeah. Okay. Either way.
We kind of touched on, it really isn't something that's like breedist. Like any breed can come in with a pinched nerve. It's not something like a DM or a disc disease where it tends to be, certain breeds that are really prone to it. I would say it's more so across the board. You can kind of see it in anything. Definitely going to be more common in your very active pets. So if you have kind of a couch potato pet that hasn't really been active most of their life, I wouldn't say it's probably as common to happen in them. But we do see quite a bit in our rescue dogs that people have adopted and perhaps had a couple years that we don't really know what happened to them, or, puppy mill dogs, or even pets that we know have been abused. Those guys do have a tendency to have issues with pinched nerves just because you don't know really what's happened. But they tend to do really well with chiropractic. Same thing if you have a pet that is prone to accidents or clumsiness, those guys have issues with it as well. And again, there's really no age. I mean, again, we've worked on like 6 months old and 15 years old. So they can really get it at any point of their life. It's really up to them as to when they show you those symptoms, right? So if you have a 6-month-old dog that for 6 months of its life has been nuts and plays like crazy and is a crazy pogo stick jumper up and down, those guys are probably ones that will show you something as an issue earlier than others. Whereas when you look at more of your senior dogs that are like 13 through 15, a lot of those guys are kind of pinched nerve secondary to some arthritis. So it's more of a buildup of just wear and tear on their body. Again, still super manageable and, something that we can definitely help remedy, but kind of different reasons is why you might see it with either one. As far as symptoms go, it's hard to miss when you have someone in an acute pinched nerve. I mean, it's not something that you can really ignore because they let you know that something is wrong. But I would say if your pet isn't screaming or your pet isn't suddenly hesitating to do their normal routine, there are some little subtle things that might precede the screaming. So if you have a pet that they should have a very level top line, meaning when you stroke their back, there shouldn't be any rises or divots. Like it should be very level. When you see your dog suddenly start to have this arch in their back, that is usually a really good sign of a pinched nerve starting up. A lot of dogs will hunch to try to relieve pressure on their low back. It helps when they go to the bathroom and that sort of thing too. So if you see them starting to develop a hunch, or if you notice that even when they do go to the bathroom, kind of the way they're going is different. So if you have a dog that always hikes one leg and now they're using two, or you have a dog that is starting to walk when they use the restroom as instead of staying still, like things like that can all be little subtle changes that would be a good idea to get them checked out. Obviously, limping is a good start as well. Very rarely is it like pinpoint pain in a limb. So that's not usually something that we see, but definitely if you have some limping or some swelling. So if you notice like a wrist, you've got some excess fluid or some heat, if you feel heat coming off of any specific joint, that's usually a really good indicator that something going on. But probably one of the biggest ones that, aside from the screaming, that you can notice is this like cringing like this, especially in the neck. Like they'll have this like weird, it's an uncontrollable muscle spasm, right? So you'll see actual twitching and shaking when nobody's touching them in those neck muscles. Not quite as bad in the low back and the back legs. You might see a little bit of shaking back there, but I would say you'd probably see more of the hunching and the limping as far as that goes. But when it comes to the neck, you'll see that twitching. Their muscles are they're like fireworks. They're very sensitive, responsive. Yeah, total spasm all throughout. And if you try to pet, a lot of those dogs will really dip their head and try to avoid you. They'll cry out without even being touched because they're scared to be, trying to protect themselves. And a lot of times what you see again is like when they do try to shake, they'll scream or they'll really cry out or they'll stop themselves. You'll only get like a little thing like this, and that's all you'll see. If you ever see that with your dog, that's a really good indicator that something is definitely bothering them and it should get checked out. So those are all kind of what I would say would be your main symptoms to look for.
I remember very vividly the first pinched nerve beagle that came in to see you. Like this little dude is ingrained in my doodle because he was so like, it was like a person, like you could tell he was in visible pain, and he was even walking cautiously. It was, and he wouldn't move his head, but he'd move his eyeballs, like trying to look around because he didn't want to move his neck because the pain was so, you could tell he was very painful and had the spasms and the panting. to go along with like the pain. But he just came in and like stood there and was like, "Oh dear God, what else do I have to do?"
Yeah. Oh yeah,
I totally
absolutely. I mean,
remember
there's
him.
yeah, he couldn't, and that's super typical too. Like any kind of neck pinch nerve, those dogs, instead of being able to lift their head up and down, they carry it like almost like hunched up. Like if a human was
Yeah, it's
walking
almost
around
like a person. You're like, "Oh, I can't move, so I just move my whole body."
yeah, they'll turn their whole body to see you. You know, you hit the nail on the head, and a lot of times you'll just visibly see the pain in their eyes. They'll be like very dilated and stressed. Like you can just see that they're stressed out, and it's so sad because you feel so helpless and you don't know what to do for them because Grant would attest to this. Like I would say neck pinch nerves are by far like our saddest cases just because they're so in pain and you just want them to feel better, but it still takes time. So it's one of those things like as much as we want it to be instant, a lot of times with the healing process too, I've got one that I'm working on right now that literally like the day after she got adjusted, she was doing awesome, but she overdid it. And then the next day she was like, you know, back to how she kind of was. And there's always a learning curve with it. So I would love to say that it's a very quick, like, you know, a piece of a puzzle. Like I put a piece of the puzzle in and you're good to go. But it's also their body has to adapt back to a new normal, you know, instead of being in this like spastic kind of thing you're dealing with. So it does take time for that to heal no matter how you slice it. Some definitely respond very, very quickly and within an adjustment or two are almost back to normal. And I would say that's definitely more of your younger ones that don't have other cofactors going on. If you have an old dog or even like a middle-aged dog that is starting to have issues, like there might be other factors like arthritis or maybe they have disc disease. Like there's other things that could be going on that can contribute to a slower healing process, but they can heal all the same. It's just a little bit longer. So yeah, I think we say it pretty much with everybody that Grant and I are pretty set on like our 3 adjustment gold standard. And that goes even for a pinch nerve. Like if you don't see any improvement within 3 adjustments, then it's likely not going to really make a difference for you guys. But that being said, like even having just that one good day shows you that we can get to that normal again. It's just a matter of making it stay and making it work and making their body adapt, which it can adapt so much faster than humans. They're very good about listening to their body. But yeah, you know, pinch nerves are so common. Like I remember this Doberman, she came to you guys too, that was 15 and she came in and she couldn't lift her head. And she was to the point where she was knuckling and losing her front legs just because she really like couldn't, her brain wasn't able to send these messages properly because she was so bad. And 3 adjustments, that dog was fine. I mean, it was crazy to just see how, you know, people will go from being ready to euthanize their pets because they're in such pain and they don't know what to do. And, you know, you and I have seen several that are on every medication imaginable and they're still in so much pain. So just imagine like how bad that has to feel if while on steroids, muscle relaxers, more anti-inflammatories, multiple anti-inflammatories, they're still feeling that pain. So, you know, it's definitely something that it's not our most fun to work on. And a lot of times I feel bad for like clients if they're waiting outside of a waiting room and they hear these poor babies have issues. I promise we're not hurting them. It's just one of those things that as soon as you get movement back in there, that inflammation can finally release and they can start to actually heal. So it's definitely something that is like bread and butter in our practice, but it's awful as an owner to have to go through that and watch your baby go through it. But there are definitely things you can do in addition to chiropractic to help with that, you know? So we have, obviously we love CBD. Like CBD for this is awesome because if your pet is on all these other meds and you're still having issues, like the hemp oil is really great because it doesn't interact poorly with anything else they're on. And it's an awesome natural anti-inflammatory and it's fast acting. So you've got like three things that are all in your favor. And the other really nice thing is, especially while a lot of these pets are starting to wean off of like a steroid or something else that they might be on, it acts as like a buffer. So they're not going from straight up being dependent on all these medications to be able to function to nothing at all. They have like this interim where they still have a little bit of backup in the form of CBD to help with that. And it can totally be used as needed and all that sort of thing. So a lot of these dogs have a lot of trouble sleeping because they're in so much pain. And I would say the CBD has helped with that quite a bit. It helps them get a good night's rest. It helps their body heal, because if they're not sleeping, their body's not healing. So a lot of times once these pets get adjusted once or twice and you get them on the CBD, they will literally zonk out for like 12 to 16 hours just because their bodies are so tired. And, you know, they're spending so much energy on just kind of functioning because they're in so much pain that it's like a welcome release. In addition to that, there's a lot like in the acute phase. So we love ice. Like ice is awesome for these sorts of things to help with the muscle spasm and all that heat. So we always recommend trying to do like either crushed ice or like a bag of peas, because then it can kind of disperse and not be too heavy on your pet instead of like a human gel pack. So use your judgment. But icing a pet that's got, and you'll feel it. You know, this isn't something that you have to like fake yourself out to know whether or not there's heat coming off of them. Like you can feel heat radiating off of those areas. So I always tell people icing for, 10 to 15 minutes at a time, and then a few times a day is really, really good. Usually when we have patients come in with issues, Grant and I will show people how to do traction at home with their pets. Super gentle, but it can be a huge release too, at least in that like initial phase, because they can't stretch out themselves. You know, they're not able to usually do a downward dog or dog or anything like that. So it's helpful when you can kind of do it for them, but very gently. The other thing we always say is nix the collar while, your pet is going through, especially if it's in their neck. You got to get that thing off of them, even if it's just for a short time. And that's actually, I think something I totally missed is that one of the huge causes of this is pulling on your flat collar or your martingale or whatever you might have on their neck. This is why so many dogs at age 3, 4, 5 have horrible pinched nerves, is because pull like crazy. And maybe they don't anymore, but they did for however long. So collars can be a little bit of a touchy one if you have a pulling dog. I think that's something there's a constant debate about. We are lucky enough to have very well-trained and heel dogs now. They haven't always been that way, and it took a long time to get them there, but well worth it. And, a harness is great because it definitely removes the pressure off of their neck. But if you have a rambunctious dog, it definitely gives them a lot more control when you're walking. So I would say when it comes to that kind of stuff, get yourself a good trainer and get that fixed, because there's definitely ways that you can do that. But there are a lot of long-term effects to a constantly pulling dog, like on your walks. I mean, Grant and I see it every day when we walk our dogs, how these other dogs are walking their owners. I mean, to the point where they're just like choking themselves to go somewhere. And that has long-term repercussions, usually in the form of a pinched nerve. So if we can write that at a younger age, that helps, I would say, a lot going forward. But yeah, so between icing, like gentle massage all up and down their neck or their back, we're fine. They'll pretty much limit their activity for the most part. There's not much that you're going to have to do as far as that goes, especially in those like initial moments. But if your dog feels okay enough to go on a W, you're welcome to do it, but it's not something that they tend to want to do because they don't feel good. And then I would say, obviously, the CBD is awesome. I know you guys have a lot of other like things that you can use in that acute phase, but I think that's probably your most fast acting. I'm sure there's other ones that we can recommend too, though.
Yeah. And I just pulled up real quick. If you just do a quick search at thepetbistro.com, we have 4 pages worth of hemp products. Yep. So whether it's looking at a chew or an oil or a treat, or I mean, there's so many different variations to help your cat or dog to get that into your pet. We're more than happy. Our staff is very well trained in CBD products, full spectrum hemp products, how to choose the right one for your pet, what's gonna be best for you, and making sure that you can dose it and get it in a couple times a day. So anyone on our staff would be more than happy to help anybody find or figure out which hemp product is going to be best for their pet and their household. So
awesome. Yeah. So I would say that's pretty much where you start. And, chiropractic can be, it's usually like one of the best things you can do for a pinched nerve. Between that and maybe a little bit of acupuncture to help with pain, it's really, really helpful. Obviously, laser is really good too. A lot of our acute pinched nerve patients also get some laser done while they're there, just because it's really helpful, especially for that big gulp of inflammation that they're dealing with. But yeah, it's super helpful. You guys have that to offer as well. So there's a lot of options.
And depending on what's going on with your pet, if quite a few of our staff members can kind of, get some more symptomology from the pet owner to help with maybe picking one or two supplements on board to go along with the chiropractic care and what you and Dr. Grant do. So number 8 cell salt, which is mag phos, is fantastic for spasms. It's actually pretty well known for like leg cramps and spasming and things of that nature. So that is just getting some minerals back in the body, getting the minerals balanced enough that the spasms can stop, which can be really helpful. Obviously, your CBD and full spectrum hemp products are awesome. We do have a couple other herbal blends that are specific for aches and pain and helping reduce just overall some pain management. I know we have had more customers come in lately where they don't feel like the full spectrum hemp has really helped their pet. So sometimes we switch over to working with more herbal based items. So those are all options. We have plenty of options. The one thing that I love about Dr. Grant and Dr. Christina, when they're done with chiropractic care, you will also get a report emailed to you. And that can be really helpful down the road. So if we have 3 or 4 chiropractic appointments and you guys always list each appointment, you have 4 or 5 in there that you can kind of compare to from your current appointment to your previous appointments. Each vertebrae also has different amino acids and minerals that go to each one. So if we get down the road and we're still dealing with whatever sort of chronic or acute health complaints and you set up an appointment with me, we can always go back and look at that report and see where the body's always out and possibly see if there's an amino acid or a mineral or something that's missing. It's kind of like another piece to the puzzle. You put all those, you lay out all the puzzle pieces and you start feeding the body at the cellular level that it can help with chiropractic with holding the adjustments, as well as getting the nutrients back into the body where they need to go, which is pretty cool. So I love how all those little pieces kind of go together when we work together too.
Yeah, absolutely. And well, I think my favorite story is that of Bennett, where remember I kept adjusting the exact same segment. He was always out. And it so happened, I believe it was lead that he tested for. And then we found out that he had literally lead, pellet bullet.
Yeah. So it was, Bennett's story is fantastic too. So he was a dog that came up from Hurricane Katrina. Katrina, right? No, Hurricane.
He was in Texas. Nope, you're thinking of it. Yeah.
Not Katrina. Yeah. Was it Harvey maybe? That went through Texas? We should live in the South. We know all these. So he came up. He was a hurricane dog from Texas, came up, and he was found wandering the streets. There wasn't really a backstory. And the owner said that he always seemed painful or flinched every time she gave him just a good hard pat and good boy, attaboy kind of deal. And you had done quite a bit of extensive chiropractic with him and still had some sensitivities. And the owner, you had recommended just, on his next wellness visit to just go ahead and do an x-ray just to see if there was anything that you were missing. Yeah. And it just so happens that he was essentially full of buckshot. And I mean, so much of it that there was no way that it could all be removed. It was literally from neck to hip. Mm-hmm. And I hadn't known about this. I have chills just talking about it. So, I had muscle tested through different vitamins and minerals and amino acids, and the amino acid that came up was lysine. and started reading a little bit more about lysine. And lysine is actually very effective for lead poisoning. And so once we started him on his supplement program, which included lysine, the owner saw a lot of those like sensitivities or those things that were bothersome to him start to dissipate. And of course, she still continues to do chiropractic because of all his benefits. Yeah. So yeah, he's a great story too. Bullet and Bennett.
Bullet and Bennett. Yeah, it's crazy when you think about that stuff. But yeah, they do awesome. I mean, it works so well hand in hand. And I mean, I know that our pets are significantly healthier because we don't just do one avenue. They have, they're raw fed, they have supplements, they see you, they just are, I mean, they're well adjusted. So I think that it's made a huge difference in their lives, and I can't recommend it enough for anybody else. But yeah, so let's talk about appointments, because I know we want to talk about that really quick.
Yeah, of course.
So appointments are
with the dog with the pinched nerve. I know those little guys can be so painful sometimes. I feel like they're the only ones that are like really the yippers.
Yeah,
it's like that release of like How often would you recommend an appointment for a dog that has a pinched nerve?
So pinched nerves are pretty standard. A lot of other things will differ based on age, breed, what's going on, and that sort of thing. But with pinched nerves, I would say the majority of these dogs we probably see weekly for literally 3 visits. So once a week for 3 weeks in a row. And then we kind of reevaluate and see how they're doing. Sometimes if they're that bad, and that tends to usually be in the neck, if they're really, really bad, we might do twice a week for a week or two just so we can get them over the hump. But for the most part, I would just say weekly for 3 weeks. We'll kind of check in, see how we're doing, see if we've made improvement, and then make a game plan from there. But it's pretty easy to tell whether or not your pets are going to respond. So yeah, those are probably the only ones that I would say have a pretty blanket like protocol in our opinion. And everyone's a little bit different, but not by a lot when it comes to a pinched nerve. And again, like I said, maybe with a really young puppy that it's the first time something's ever happened, they might respond very quickly and not need 3 weeks of, right in a row treatment. It kind of depends on those guys. But I would say anything that's like a full grown pet to a senior, that's pretty typical. But yeah, super easy to make an appointment. I know that we've been a little bit booked recently, which is a good thing, but also can be tough for people to get something. But the nice thing is there are 2 of us, so are at the store at least 3 times a week, and this is our Saturday there. So I will be at the store on Saturday from 10 to 1. So if for whatever reason people are trying to get in with me and they can't get in, don't worry. There's options on Saturday. You just have to call or go on the website. So our initial exam and adjustment runs $90 and usually is between 20 to 30 minutes long. It includes a full history, a full exam, and an adjustment. Follow-ups, same exact thing, minus the history because we already know you guys. Those are $55 and run between 10 to 15 minutes. So it's really easy to schedule. Like you said, Jill, like pretty much I think we've adjusted all of your employees' pets, at least one of them. Yeah. So they're super well-versed in chiropractic and what we do. So a lot of times if somebody has a little bit of a question, you guys are really easy to help with and can answer them pretty simply. Otherwise, obviously people can call us and have a chat too, but whatever's easiest for them. But yeah, scheduling online is super easy just because you guys are, you have a life outside of the store, so you're not there 24 hours a day. So if you want to book something at 10 p.m., which tends to be a very busy time for our phone lines and for our messages.
Really, because something happens.
I know. So 10 to 10:30 tends to be super busy. So fret not. If something happens between those hours, you can literally visit their website and get an appointment scheduled. So there's always options. But yeah, we were laughing about that last Thursday. I think we had 6 calls come in between 10 and 10:30, and we're like, holy mackerel, what is going on now?
Yeah. Oh my goodness.
It was nuts. But yeah, so there's always ways to schedule. It's easy peasy. I think you guys have it right at the bottom of your webpage on every page.
Do. And I was also pulling up, so we do have some information online here about animal chiropractic visit. So if you go to our online store, thepetbistro.com, go under About Us Wellness, and then we have our different consultation services as well as the animal chiropractic. So we have a couple of quick videos explaining chiropractic and a video with you, and then one with Dr. Grant, so people can kind of get to know you guys a little bit prior to the appointment. We have some other videos. Obviously, all of these videos that we are, every Monday night Chiro Chat is also on YouTube. So we have a whole playlist with Advanced Animal Chiropractic. And I know you guys have some great videos on your YouTube channel as well. Just some before and afters, and even I think you guys have them labeled by diagnosis, like IVDD and disc and things like that. So this has the price as well. So it explains a little bit more about the chiropractic services that we have at the store. Anyone's always welcome to give us a call if that is easier. You guys can call us. We're happy to answer any simple questions if it's nothing that is, something that would be better for you guys to answer if that has anything to do with an adjustment or whatnot. But we, like Dr. Cole has said, pretty much all of I think everyone on staff has had their animals adjusted, and we've all been in appointments and have seen appointments and can answer quite a few questions, and all the different animals that do come in for all ranges of reasons. So we have seen quite a few success stories as well. The other thing that we have at our location at the Pet Bistro is if you are a frequent flyer or you have multiple pets, we do have a buy 12 get one free chiropractic frequent buyer program. So you don't have to buy them all at once. It is they do accrue. So as you come in for visits, we have a program that electronically tracks all of them, and your 13th visit with your follow-up is free with Dr. Grant or Dr. Christina. So that might be helpful to some, especially multi-pet households. That seems to be nice.
For sure. Absolutely.
Yeah. So if anybody has any questions, comments, please put it in the comments below. It looks like we had Tina. She actually tagged a friend. Maybe there is somebody that is dealing with a pinched nerve issue with their pet. Catherine, if you have any questions, please feel free to put it in the comments, leave us a message. One of us will be happy to circle back around and see if there's something that we can answer for you. Or if you're interested in setting up an appointment, give us a call. We can help you out. So, and like Dr. Cole said, you guys are at the store pretty much 3, if not 4 days a week. There's pretty much availability pretty much every week. So, and then morning and afternoon, evening schedule. So to help you guys, everyone I know has different work schedules and whatnot. So that seems to have been really helpful. But
yeah, for sure.
Awesome. So I know we have kind of moving up the spine. If anybody has any ideas, please let us know. We do have a couple ideas on the list that people have mentioned. So we'll make sure that we cover those topics. Next week, we are going to go into, do you know where we're heading next?
Not yet, but I'll come up with them.
So we still have, we're at pretty much the neck. We can talk about elbows and all sorts of things that happen, ear infections, vestibulars, cranial.
Yep. Couple things.
There's a lot of good stuff up here. The Alice, I feel like I need chiropractic care. I feel like my head needs to get back on straight. So I can only imagine what our pets feel like, and they can't tell us.
Right. No kidding.
Awesome. I'm so glad everyone was able to join us tonight. Another fantastic Chiro Chat. We'll be back here next Monday, 7:30, again with a new topic. Have a great night, guys.